Hello, I'm James Nicholl. I'm an orthopaedic consultant and I specialise in hand and wrist surgery. Carpal tunnel syndrome is a trapped nerve in the wrist, and patients experience numbness and tingling going into their fingers. Typically it's the thumb, index and middle fingers, and often initially it's a problem at night. People are woken up with painful pins and needles. It may occur when they're sitting reading, holding a book, or when they're driving or holding their phone. If the condition progresses, then you can actually lose feeling in the fingers. They go numb, and then you find you're dropping things, and you struggle with sort of fiddly tasks, perhaps picking up small objects. The treatment options are that if it's predominantly at night and waking you up, wearing a splint to hold the wrist straight can be helpful. A cortisone injection into the carpal tunnel will often settle the symptoms if they're intermittent ones, but this may only work temporarily. And the definitive treatment is to have an operation to release the nerve, which is done under local anaesthetic. It takes about 15 minutes and the recovery is usually fairly quick and easy. If a patient has got permanent numbness in their fingers, or if they've started losing the strength of the muscle that moves the thumb, then surgery is the only option which is likely to reverse that. Dupuytren's contracture is a condition that affects the hand where there's a build-up of the fibrous tissue underneath the skin, and over time the fingers gradually bend down. The speed with which this happens is very variable. Usually when the lumps first appear and the fingers still straighten, we would recommend that there isn't any treatment and that we just monitor things and advise patients to keep an eye on it. If the fingers bend over such that the patient can no longer get their hand down flat, then this is the time we would treat it. So from the point of view of degrees, if the first knuckle nearest the hand bends to 30 degrees or more, or if the middle knuckle in the finger bends to 10 degrees or more, this is when we would recommend treating it. If the fingers have bent right down into a severe contracture, then it can still be treated, but it becomes more difficult, and the likelihood of a good result becomes less. Arthritis can affect almost any of the joints of the hand and wrist. Often this will occur spontaneously, but it can be following an episode of trauma which has damaged the joint. Initially, the pain is controlled with simple measures such as using painkillers and rubbing in anti-inflammatory creams and perhaps wearing a splint. Beyond this, steroid injections into the joints can give good pain relief for a prolonged period, but they're not going to cure the arthritis. Ultimately, if any joint remains very painful and the patient needs more definitive treatment, then there are a whole variety of operations that can be done to relieve the pain, ranging from fusing bones together, taking out the arthritic bone, and even putting in artificial joints made of metal or plastic, which are very good at relieving the pain for some of the affected joints.